is Shabina and I'm going to be demonstrating the female catheter insertion and removal. So the first thing that I will do is verify my physician's order in the medical record and gather the appropriate equipment. So I will need a pair of gloves, some wipes, a towel, and my catheter kit. I'm going to check to make sure that my catheter kit is not expired and it's intact, and the kit is. For the purposes of the video, I'm just going to leave it here to the side. Okay, and I have my hand sanitizer just to clean my hands. So I'm going to knock on the door. I'm going to enter the patient's room. Hi, Mrs. Smith. My name is Shabina. I'm going to be your nurse today. How are you doing today?
I'm doing well.
Okay, so I'm going to wash my hands. Okay, Mrs. Smith, can you verify your name and date of birth for me, please?
Mrs. Smith, 9/30/94.
Okay, perfect. I'm going to double check and make sure that that's the correct information on the armband, and it is. Okay, so I'm going to provide for privacy. My trash can is on the floor and at my disposal. I'm going to ensure that there is adequate lighting. Okay, so Mrs. Smith, I'm here to insert a female catheter into you to help you urinate. But before I do that, I just have a few questions for you. Do you have an allergy to iodine or shellfish?
No.
Okay, so as long as that's good that you don't have an allergy. Okay, so before I start the insertion of the catheter, I'm going to perform some peri-care. So I will raise the bed up to my level, and once the bed is up to my level, I'm going to make sure the side rail is down and the opposite side rail is up. I'm going to wash my hands. My hands are washed. Okay. I'm going to don my gloves. Okay. Okay. And I'm going to assist the patient into a supine position and help separate her legs. Okay, I'm going to pull her gown back, and I'm going to spread this towel over her to provide for some privacy. Okay, so Mrs. Smith, I'm going to be performing the peri-care for you, okay? Just going to move this out of the way. Okay, so I'm going to grab my first wipe here. Okay, I'm going to hold on onto her labia, and I'm going to separate it. And once it's separated, I'm going to go on, starting on one side, I'm going to go from front to back and wipe. I'm going to throw that away. Then on the other side, I'm going to go from front to back as well. Throw that away. And with the third wipe, I'm going to go from front to back down to the center and throw that away. Okay. Just going to put this to the side here. And I'm going to take my gloves off. Okay. And I'm going to wash my hands. So now I'm going to be opening my catheter. I'm going to be maintaining the sterile technique. I would raise the table up to my position, and I would make sure that my arm doesn't drop below my waist in the clinical setting. But for the purposes of the video, I don't have a table that is at my waist level. Okay, so I'm going to grab my kit. I'm going to open my kit. I'm going to remove the catheter. I will drop that. Okay, I'm going to take this paper. I'm going to fold this up. And I'm going to store it in my pocket because I'm going to put that for documentation later. And now I'm going to begin the process of opening my catheter kit. So I'm going to grab the 1-inch border, open it away from me. Okay. using the 1-inch border to the side and the 1-inch border. Okay, grabbing the 1-inch border, going to open it away from me, and I'm going to turn using the 1-inch border. Okay, touching the border, I'm just going to go around my field. I'm just gonna move this over slightly so I can have a little bit more room. Okay, I went around my field. Okay, and I'm gonna grab my gloves. Okay, and I'm going to drop it to the side. Now I'm going to grab the 1-inch border of my drape. Okay, going to open that up. The shiny part is underneath. So I'm going to walk this over to my patient without turning my back to any parts of my field. And I'm going to drop that down. Okay, going to move back over to my field. I'm going to come to the side here and I'm going to open my gloves. So using the 1-inch border. Okay, I'm going to open my gloves. So my first step is I'm going to put my glove, I'm going to grab it on the inside where the cuff is located. Okay, the glove is on. The other glove, I'm going to go underneath the cuff. Okay. I'm going to fix my fingers here, and I'm touching the center part of my glove to bring it down further. Okay. 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 So now I'm maintaining my sterile feel. My hands are sterile. I'm going to grab my drape. And since my hands are sterile and this is sterile, I can open it at any point. Okay. I'm going to grab my drape, move it over. Okay. And I'm going to drop this down on the patient. Okay. Going to, without touching that 1-inch border, just adjust that gently. Okay, now I'm going to come back over to my field here. Okay, I'm going to rotate my catheter kit without touching the 1-inch border. I'm going to move this over here. Okay. I don't need both packs of the swabs, so I will drop that. Okay, I'm going to go into my catheter kit right here. I'm going to grab my plastic and I'm going to remove it while securing my catheter tip. Okay, I'm gonna inspect the tip and make sure that it isn't defective and the tip is in fact good. Okay, I'm gonna drop that. Okay, to gently press this back down. Okay. Going to grab my saline flush. Okay. I'm going to drop that. Okay. Going to drop that. Gonna come back over here. And I'm going to attach my syringe. Okay. My syringe has been attached. I will place this gently back into the box. And I'm just gonna fix my catheter slightly. Okay. Okay. I'm gonna move back over here. Gonna take my lubricant. Going to open that up. Drop that out of my field. Going to insert it into my tray here. Okay. Drop that. Gonna grab my swab sticks. Okay. Drop that. Okay. Going to place this in my tray, maintaining the 1-inch border. Okay. Now I'm going to take my catheter and I'm going to place it into the lubricant here and lubricate it as best as possible. About 4 inches. Okay. Going to leave that in my tray. Now I'm going to transfer my tray and my box to my patient, maintaining a sterile feel and watching the 1-inch margins. Okay. Okay. So now, Mrs. Smith, I'm going to be inserting the catheter into your urinary meatus. If you feel there is going to be some pressure, but if it's anything more and you feel a lot of pain and discomfort, please let me know. So this will now become my non-sterile hand. I'm going to hold on to the patient's labia and I'm going to separate it. And then I'm going to grab my first cleaning swab and going from a front to back motion. From front to back, I'm going to clean the first side. Bring that around, dispose of it. I'm gonna grab the second swab, going from front to back, just cleaning it, disposing of it. I'm grabbing my final swab, going to go down into the center, and from front to back, cleaning it out. Okay, and then disposing of it. Okay. So, Mrs. Smith, I'm going to be inserting the catheter into your meatus now, okay? So, maintaining sterile technique, I'm going to grab my catheter and I'm going to insert it into the meatus. I'm going to insert until I see urine. I do see urine, and because it's a female, I'm going to progress 1 to 3 inches further, okay? So that is now in there, and I'm gonna take my other hand now and stabilize there. Okay, now I'm going to come grab my syringe. Okay, and I'm going to inflate the balloon according to the manufacturer's recommendation. So Mrs. Smith, please let me know if you feel any pain or discomfort while I'm inflating the balloon. So I'm going to inflate the balloon, maintaining pressure. If at this point the patient is feeling pain or discomfort, I would deflate the balloon and move and insert the catheter further and try and inflate it again. If she still feels pain or pressure, I will deflate the balloon, remove the catheter, and let the provider know that we weren't able to catheterize the patient. Mrs. Smith currently states that she's not in any pain or any discomfort, so I'm going to continue inflating. Okay, so I'm going to tug on this, and it is currently secure into the patient. And since it's secure, now I'm going to take my other hand and I'm going to, while maintaining pressure, I'm going to remove my syringe. Okay. At this point, I will take this off of my patient. We'll grab my tubing. I will secure it to the patient's abdomen or to her thigh. So that has been secure. And for the bag, I will hang it on to the patient's bed at a non-movable part. And for the purposes of the video, because I don't have a non-movable part at a lower positions below the patient's bladder, I'm just gonna hook it onto the table here. Okay. When that is done, I'm going to clean up my supplies. How are you feeling, Mrs. Smith?
I'm doing well.
Okay, that's good to hear. So I'm gonna clean that up. Gonna take my gloves off. Okay, dispose of that. I'm gonna put the patient down into a comfortable position, and I'm gonna perform some hand hygiene. Okay, so Mrs. Smith, your catheter is in there. So once that is done, I'm going to leave the room. I will document the type of catheter used, the size of the catheter used, the amount of urine in the patient's bag, the color of the urine, the odor of the urine, and the quality of the urine, and how the patient tolerated the procedure. Okay, so now it's 2 days later and the catheter needs to be removed from the patient. I'm going to check the physician's order and verify that it does need to be removed, and the order does state that the catheter needs to be removed. Okay, I'm going to grab my supplies. I have my sanitizer, some glove, my syringe, some wipes, a pad, a towel. Okay. I'm going to knock on the door. Hi, Mrs. Smith. My name is Shabina. I'm going to be your nurse here today. I'm going to wash my hands. Mrs. Smith, can you verify your name and date of birth for me? Okay, she verified it. I'm going to double check on the bed to make sure it's correct and it matches, and it does in fact match. Okay, Mrs. Smith, I'm here to remove the catheter from you. So I'm going to provide for privacy, going to make sure there's adequate lighting, and I'm going to raise the bed up to my working level, making sure this side rail is down. And that side rail is up. Okay, I'm gonna wash my hands again. Okay, I'm going to put on my gloves. Okay, and I'm gonna help the patient into a dorsal recumbent position. Okay, she is in that position. I'm going to grab my chalk. Going to place this underneath the patient's buttocks and tuck it in. Okay, and she does have a garbage can by her bed. Okay, so Mrs. Smith, I'm going to be removing the catheter from you now, okay? I'm gonna take my syringe, take off the cap. I'm going to insert it into the catheter, okay? And I'm going to let the balloon deflate by gravity. Okay. Okay. Going to ensure that all liquid is out of all of the liquid is out of the balloon. Okay, and now I'm going to gently remove the IV catheter from the patient. I'm not going to force it. If while we're removing it there is resistance, I will insert my syringe back into I would try to remove more fluid from my syringe. If the resistance is still met, then I will contact the provider and let him know that the catheter cannot be removed. Okay, so now Mrs. Smith, I'm going to be removing your catheter, okay? Are you ready? 1, 2, 3. Okay, the catheter has been removed successfully. Okay, I'm going to gather my supplies. I'm going to remove the bag from the bed. It was at a non-movable part of the bed, but for the purposes of the video, I had to hook it onto the table. I'm going to note the amount of urine, the color, okay, odor, consistency, and quality of the urine. I'm going to wrap this up. Okay, and I'm going to throw this away. I'm going to provide some pericare now to Mrs. Smith. Okay, so I'm going to take my wipe. I'm going to hold on to her labia and separate it. And I'm going to go from front to back on one side. I'm going to repeat this on the other side as well, front to back. Okay. And I'm going to go front to back from the center. Okay. That is all clean. So I'm going to take my towel here and wipe her up, make sure she's all clean. She's all clean. I'm going to remove my gloves. Okay. Wash my hands. Okay. Gonna lower back the bed, put the client back into a comfortable position. How are you feeling, Mrs. Smith? Okay, she said she is feeling well. Okay, Mrs. Smith, that's all for the procedure. If you have any questions or concerns, please let me know. She doesn't have any questions or concerns. Okay, so I'm going to leave the room. When I leave, I'm going to document that the catheter was removed, the amount of urine in the bag, and the patient's tolerance to the procedure.